Of course, today it is Wednesday, so here's some health news for you. This one is actually wild. A startup called Science Corp just got European approval to sell a brain-computer interface device called Prima. It restores vision for people with age-related macular degeneration. That is one of the leading causes of blindness worldwide. Now, a small chip gets implanted behind the eye in an hour-long outpatient procedure. And then, the patient wears camera glasses that beam a view of the world to the chip. Results so far sound remarkable. Patients finishing novels, drawing, playing crosswords again. Now, the company, founded by Neuralink's former president, Max Hodak, also got fast-track status from the FDA that could eventually bring that device to two rare forms of blindness in the U.S. It ain't cheap. It's expected to cost in the hundreds of thousands of dollars per device. Reimbursement discussions obviously still ongoing, but Germany could see its first procedure as soon as September. Worth keeping an eye on, literally.
So you're telling me we cured blindness?
I mean,
what?
There's steps.
That's crazy.
Steps, yeah.
Hey, good news for families dealing with food allergies. A new Stanford medicine trial found out about a third of kids with multiple food allergies were able to safely eat full servings of foods that used to trigger them. The key was a drug called omalizumab, or Zumab, which blocks the antibodies behind allergic reactions, either on its own or paired with oral immunotherapy, where kids eat tiny growing doses of the allergen over time, or little peanuts at a time. Researchers say the big takeaway is choice. Some families just want protection from accidental exposure. Others want their kid eating peanuts at a birthday party without being scared. And now there's data to help tailor treatment to that goal. So if food allergies are part of your household, it's worth bringing up maybe next time at your visit to the allergist.
Yeah. For sure. Well, and tick season, it's getting worse. Over 31 million Americans get bit every year. Cases of Lyme disease and other tick-borne illnesses, they're also on the rise thanks to warmer winters and expanding tick ranges. Now, the good news is speed matters, since diseases can transmit in as little as 36 to 48 hours. So you got to remove the tick as quickly as possible, and then early treatment can make a really big difference. So a new at-home test is called Lyme Alert. It launches this month, letting you crush and test a removed tick for the Lyme bacteria in about 15 minutes. Now, experts caution this should be supplemental to seeing a doctor, not replacing that. So if you do find an embedded tick, get to your doctor for a dose of antibiotics instead of waiting on results. And that, a tick that isn't attached and feeding cannot infect you. So make sure you just remove them quickly before they can burrow into your skin.
Smart tip.